metabolic syndrome, or deeply quartet, or Revan syndrome. Also, sometimes it's called as a big man with a big file. Big man is a man with a central obesity, and he is a big file because he has a lot of investigation and a lot of treatment. So he is called a big man with a big file. What's the definition of metabolic syndrome? Metabolic syndrome is defined according to the International Diabetic Federation by the presence of abdominal obesity or central obesity together with two or more of the following: high triglycerides, low high density lipoprotein, high blood pressure, and high fasting or impaired fasting, glucose or diabetic. It's very common. In our country, actually some studies say that's about 40, but I think it's very estimated. But it's very common, this metabolic syndrome. It's a very common syndrome. What is the pathogenesis of metabolic or insulin resistance syndrome? The main pathogenic mechanism is central obesity together with insulin resistance. Central obesity could be caused by high caloric intake or by sedentary lifestyle, by lack of exercise, by lack of sleep, and also by certain type of drugs, smokers, or exposure to stress. Visceral obesity causes insulin resistance because in centrally obese individual there is increasing many type of adipokines, including resistance, and another one is called aboline, other one is called omentin. Also they decrease other adipokines, including the adiponectin. Also in centrally obese individual, 80% of them, they have a leptin resistance. Also, when the patient becomes essentially obese, there is increased certain type of cytokines, including interleukin 6 and interleukin 12 and human growth factor alpha. All these cause insulin resistance. Insulin resistance induces the risk of inflammation. It impaired fibrinolysis, increased blood pressure, atherogenic dyslipidemia, and dysglycemia. All these are the component of the metabolic syndrome. So what's the risk factor of metabolic syndrome? There is certain factors which are controllables, including the poor diet, physical inactivity, poor sleep, unhealthy behavior, زي smoking, alcohol, drug abuse. But other factors are uncontrollable, and this including the genetic factor and the age and the genders. How to diagnose? Our criteria for diagnosis of metabolic syndrome. The most commonly widely used criteria is the International Diabetic Federation criteria and the National Cholesterol Education Program revised 2004 و2005. The difference between these two definitions is the obesity. In the International Diabetic Federation, they require a waist circumference more than 95 centimeter in male and more than 80 centimeter in female. While according to the National Cholesterol Education Program, waist circumference is more than or equal 102 centimeter in male and 88 centimeter in female. Other parameters are equal. Blood pressure more than 130 over 85, triglycerides more than 150 milligram per deciliter, or on treatment, high density lipoprotein is less than 40 milligram in male and less than 50 milligram in female, and the fasting blood sugar is more than or equal to 100 milligram per deciliter, or the patient already known to have a diabetes. So the presence of one In case of International Diabetic Federation, the presence of central obesity plus 2 or more of this criteria. According to the National Cholesterol Education Program, the presence of the 3 out of the 5 criteria is diagnosis of metabolic syndrome. So what's the sequelae of insulin resistance syndrome? Insulin resistance syndrome is associated with the development of diabetes. About 83% of the patients with insulin resistance have diabetes. They have hypertension, they have dyslipidemia, and also there is increasing risk of obesity. There is increasing risk of certain cancer. There is increasing risk of osteoporosis, increasing risk of polycystic ovarian syndrome, irregular menses with dysmenorrhea in female, increasing risk of microalbuminuria and chronic kidney diseases. So the most common disease nowadays is related to the insulin resistance syndrome or to the metabolic syndrome. So what is the importance of fasting Ramadan? ربنا سبحانه وتعالى قال ايش؟ قال فرض عليكم الصيام. So fasting Ramadan is a فرض. برضه كل عمل ابن آدم له إلا الصيام فإنه لي وأنا أجزي به. يبقى الصيام هبة من عند الله سبحانه وتعالى لأنه وجد أنه يحسن all the component of the metabolic syndrome. Other type of fasting in Muslim patient is a sunnah. So fasting is an intermittent fasting. Fasting Ramadan is the best type of intermittent fasting. In order to get a benefit of fasting Ramadan, you have to continue in the other type of intermittent fasting in your sunnah. Afflicted another type of intermittent fasting. So what is the benefit of fasting Ramadan? In the brain, the hunger response and the neurotropic factor, neuropeptide Y level, cognitive function, and stress resistance is increased. It decreases the risk of inflammation and oxidative stress. In the cardiovascular system, it decreases the resting heart rate and the blood pressure. In the pancreas, it decreases insulin production. In the adipose tissue, it increases lipolysis, adiponectin production, insulin sensitivity, and it decreases leptin production and fat mass and inflammation. In the blood, there is increase in the ketone body, adiponectin level, cortisol, and ghrelin hormone, and decrease glucose, insulin, and insulin growth factor 1, and leptin level, decrease triglyceride and low density lipoprotein, and decrease inflammatory marker and CRB. In the liver, the ketone body production is increased and insulin sensitivity is improved. In the intestine, the ketone body production also is increased. In the skeletal muscle, the insulin sensitivity is improved. What is the effect of fasting Ramadan as a part of intermittent fasting in the pathogenesis and risk factor of metabolic syndrome? Since the main pathogenic mechanism of insulin resistance is metabolic syndrome is insulin resistance and central obesity. Fasting Ramadan overcome the two pathogenic mechanisms of metabolic syndrome, which is the insulin resistance and obesity. How fasting Ramadan improves insulin sensitivity? As you know, when the patient is continuing consuming food, the pancreas will secrete insulin for a long time. This leads to insulin receptor supersaturation. So the cell will go in a process called insulin receptor endocytosis. So the number of the insulin receptor in the surface of the cell is decreased. This leading to insulin resistance. So when you are in a prolonged fasting state, the pancreas undergo a rest. The insulin secretion by the pancreas is decreased, so there is upregulation of the insulin receptor in the surface of the cell, this leading to improvement of insulin sensitivity. So the most of which you have to avoid excess carbohydrate and avoid excess caloric intake. طبعا الcaloric restriction during fasting will improve insulin sensitivity at the liver and improve insulin sensitivity at the adipose tissue and improve insulin sensitivity at the skeletal muscles. What is the importance during iftar? During iftar, you have to avoid excessive glucose intake because this causes sharp increase in the blood sugar, which stimulates the pancreas to secrete more insulin. You have to avoid excess food intake. قال تعالى ولا تسرفوا وكلوا واشربوا ولا تسرفوا. قال سيدنا محمد يكفي ابن آدم لقيمات يدمن صلبه. برضه what's حلال طيبات وكلوا ما رزقكم الله حلالا طيبات. العلماء فسروا الحلال الطيبات هنا is a food of low or intermediate glycemic index. So you have to use a food of low or intermediate glycemic index. This is the halal طيبات. So how weight loss will improve insulin sensitivity? During Ramadan, the body weight is decreased, particularly the central obesity and the body mass index. The obesity play a very important role in insulin resistance, as we say, because there is increasing free fatty acids, because of increasing certain cytokines and adipokines. This causes insulin resistances. So, either fasting Ramadan has an anti-inflammatory effect. There is a decrease in certain cytokines, including interleukin 6 and interleukin 12, and tumor necrosis factor alpha, with subsequent improving in the insulin sensitivity. So when the insulin sensitivity is improved, the body weight will decrease. This is one of the components of the metabolic syndrome. The blood pressure will decrease. How insulin resistance causes hypertension? Because it activates the sympathetic nerve system, because it causes sodium reabsorption at the proximal convoluted tubule of the kidney, because insulin resistance decrease nitric oxide synthase and cause endothelial resistance. All these factors leads to hypertension. So insulin sensitivity will reduce the blood pressure. This is the second component. Insulin will improve certain enzyme called lipoprotein lipase in the cell of the endothelial cell. This enzyme is important for clearance of triglyceride. So when the insulin sensitivity is improved, the triglyceride level is decreased and the high density is increased. So all the components of the metabolic syndrome is improved, as well as when the insulin sensitivity is improved, there may be a decreased risk of developing of diabetes. Also there is improvement of control already innovation to have a diabetes. Insulin sensitivity decrease all the cardiovascular risk factor. So it is very important fasting Ramadan will protect you against cardiovascular diseases. Insulin sensitivity decrease certain type of cancer. So fasting Ramadan will help you or protect you against cancer. Fasting Ramadan will maintain your mood and your mentality, because the brain will use other fuel like ketone body instead of glucose. So the fasting Ramadan also improve your brain function. What is the cause of weight loss during fasting? Weight loss is due to either caloric restriction or due to the other dehydration, or due to the improved insulin sensitivity, or due to the feeding of satiety in order to improve the balances in satiety hormone, particularly the ghrelin and leptin. Also, fasting Ramadan increase other hormones, the adiponectin, which play a role in decreasing body weight. But when your body weight is decreasing, what is the benefit? The triglyceride decrease, the hemoglobin A1C decrease, the blood pressure decreases, also the development of diabetes and diabetes prevention. Dyslipidemia is improved, hyperglycemia is improved, and hypertension also decreased. So all type of metabolic syndrome component will decrease during fasting Ramadan. This is some of the importance of the fasting Ramadan. So fasting Ramadan protects your heart by decreasing the heart rate and decrease the blood pressure. They increase ketone body production and increase insulin sensitivity. They protect you against the cancer. They protect you against the development or control diabetes. Also, filtering, they reduce inflammation and reduce the risk of Alzheimer diseases and stroke. Yeah, it's important, and we have to continue with the intermittent fasting, not only fasting Ramadan. This is the message, and thank you very much.